Hello everybody, I am Dr. Chinnababu Sunkavalli. I am a robotic surgical oncologist practicing in Hyderabad. Today we will be talking about how to screen yourself for oral cancers. As you know, oral cancer is one of the most common cancers, especially in men in India. Next to that is lung cancer. So we must know how to screen yourself for oral cancer. Some of the common areas that are affected by oral cancer is usually the sides of your tongue, the undersurface of your tongue, or the soft palate, or the floor of the mouth, and sometimes back of your throat. So these are the high risk areas of the oral cancer. So how do you know that you have oral cancer or it has begun in your body? Some of the risk factors are the highest risk features are a white spot with a clear distinct margins, or a red spot with a well-defined margins anywhere in your oral cavity, right? Sometimes you may have an ulcer which is not healing for more than 2 weeks. That could be a risk factor for oral cancer. Similarly, any lump or bump in the oral cavity, though it is painless, could be a symptom of oral cancer. So what causes oral cancers? If you see the causes of oral cancer, it is smoking tobacco. And it's also about chewing tobacco. So either with smoke or without smoke, tobacco is the main risk factor for oral cancer. If you also consume alcohol along with tobacco, the risk also increases. Similarly, consumption of more spicy food or more spices or irritating denture or a trauma can also be a leading cause for oral cancers. So if you look at how can you do the oral cancer self-screening? So if I have to tell you what are the methods of self-screening, number one, please prepare yourself to, in front of a mirror, be ready with clean hands and a flashlight. You can do a self-examination once a month. You don't have to every day live with the fear of oral cancer, but once a month, make it a point to look at your oral cavity. Have a flashlight in hand, and it is just a simple process of examining your mouth, the whole oral cavity, and then you can look for yourself if there are any early signs of oral cancer. So for example, even as you are ready now, there is a systematic way of looking at your oral cavity. So first look at the external surface of your lips, right, and pull your lips outside and examine the inner surfaces of the lip. Then you go to the cheeks. Then you look at the gums. So completely on either side, you can examine both your gums and your cheek in the inner surface. Then you systematically turn yourself to the under surface of the tongue, the sides of the tongue, and the frontal surface of the tongue. And then you can look at the palate, the hard palate and the soft palate. Just look for any changes. Is there a white spot? Is there a red spot? Is there any ulcer which is not healing for more than 2 weeks? So you can systematically look at these areas. Then you put a small, stick out your tongue and look, on the top, the undersurface, and the sides of the tongue. And then look at the soft palate, as I mentioned before. Do not stick your tongue out when you are looking for the palate. So keep your tongue inside and look for your hard palate and the soft palate gently. So this is a simple test of self-oral cancer screening systematically, starting from your lips, externally, internally, cheeks, gums, tongue protrude outside, look at all the sides of the tongue, and then go back to the palate, the hard palate and the soft palate. This is a very simple tool. Please do it once every month. Thank you so much.